Dr. Vincent Raines had seen everything in his 15 years as a trauma surgeon at Mercy General. Gunshot wounds, industrial accidents, bodies mangled beyond recognition. He'd learned to compartmentalize, to see patients as puzzles to solve rather than people dying on his table. It was the only way to survive in this profession. But nothing prepared him for the night of October 14th. The call came in at 11:47 p.m. Multi-vehicle collision on Highway 9. 2 critical. ETA 4 minutes. Vincent scrubbed in, his team assembling with practiced efficiency. Lucia, his best surgical nurse, laid out instruments. The anesthesiologist, Dr. Okafor, prepped his station. They moved like a machine, because that's what saved lives. The doors burst open. 2 gurneys. The first held a woman, mid-30s, covered in a sheet. DOA. The second carried a man, maybe 40, conscious but barely. His chest was crushed, ribs visible through torn flesh. Blood pooled beneath him, dripping onto the sterile floor. Male, early 40s, blunt force trauma to the chest and abdomen, the paramedic rattled off. BP dropping fast. Glasgow coma scale 13. He's been alert the whole ride. Vincent moved to the patient's side. The man's eyes were open, staring at the ceiling with unnatural calm. No panic, no fear, just knowing. "Sir, can you hear me?" Vincent asked, checking pupil response. "We're going to take care of you." The man's lips moved. His voice came out steady, almost peaceful. "Don't bother stitching my chest. It won't work this time." Vincent exchanged a glance with Lucia. Shock. Had to be. Patients said strange things when their bodies were shutting down. "We're going to do everything we can," Vincent assured him. "Stay with us." They wheeled him into OR3. The fluorescent lights buzzed overhead, casting everything in harsh white. Vincent made the first incision, exposing the damage. Lacerated liver, punctured lung, internal bleeding that wouldn't stop. "Suction," he commanded. "I need more hands here. Lucia, clamp that vessel." They worked for 20 minutes. Every time Vincent closed one bleeder, another opened. The man's vitals crashed. "He's coding!" Dr. Okafor shouted. "V-fib." "Charge to 200, Vincent ordered. "Clear." The patient's body jolted. The monitor flatlined, then beeped back to life. Vincent returned to the chest cavity, hands moving on autopilot. Then the patient spoke again. Same tone, same cadence, as if he'd never died at all. "Don't bother stitching my chest." "It won't work this time." Vincent's hands froze. Lucia stepped back, her face pale. "He shouldn't be conscious," Dr. Okafor whispered. "I have him under deep sedation." But the patient's eyes were open now, staring directly at Vincent. Not through him. At him. Vincent forced himself to focus. "We're losing him again. Prepare for another shock." 15 minutes later, the man coded a second time. Asystole. No pulse, no rhythm. "Starting compressions," Lucia said, her voice shaking. Vincent pumped epinephrine, tried calcium chloride, anything to restart the heart. 2 minutes. 3. The line stayed flat. Then, a blip, a heartbeat, another. "We've got him back," Dr. Okafor breathed. The patient's chest rose and fell, his eyes opened, and he spoke, word for word, never changing tone, never asking questions. "Don't bother stitching my chest. It won't work this time." Vincent felt ice crawl down his spine. This wasn't shock. This wasn't confusion. This was something else. How do you know that?" Vincent asked, against every protocol, every rule about staying professional. The man didn't blink. "Because I've been here before." The monitor screamed. Third code, the longest one. 10 minutes of compressions, shocks, medications. Nothing worked. The line went flat and stayed flat. Then, impossibly, a single heartbeat. Weak, fading. The patient's lips moved one final time. Vincent leaned close to hear. "It worked last time because my daughter still needed me." His voice was a whisper now, barely audible. "She doesn't anymore." The line went flat. Vincent tried for another 20 minutes. Lucia begged him to call it. Dr. Okafor had already stepped away, removing his mask with trembling hands. But Vincent couldn't stop. Wouldn't stop. Finally, at 2:34 a.m., he stepped back. Time of death, 2:34. Vincent didn't sleep that night. He stayed in his office, staring at the patient intake form. Name, David Brennan. Age, 41. Next of kin, Emma Brennan, daughter, age 16. Something gnawed at him, the way David had spoken last time. What did that mean? He pulled up the accident report from Highway Patrol. 2-car collision, head-on. David Brennan, driver. Emma Brennan, passenger. Emma Brennan, DOA. The girl on the first gurney, the one covered with a sheet. Vincent's hands went numb. He scrolled further through the database, checking old records. Anything with David Brennan's name. There, 3 years ago. Same hospital, same highway. David Brennan, admitted after a severe car accident. Crushed chest. Internal bleeding, coded twice on the operating table. Surgeon, Dr. Vincent Raines. Vincent remembered now. The man who'd survived against impossible odds. Who'd fought back from the brink 3 times. Who'd whispered, as they stabilized him, "I have to stay. My daughter needs me." He'd lived, against every statistic, every medical probability, because his daughter had been in the waiting room, alive and terrified, begging God not to take her father. Vincent closed the file with shaking hands. David Brennan had known the outcome, known that this time there was no reason to fight. No daughter waiting, no purpose left. He'd died exactly when he chose to. Vincent never performed another surgery without wondering how many of his patients had held on simply because someone was waiting. And how many, like David, had let go the moment that reason vanished. He still worked at Mercy General, still saved lives. But sometimes, late at night, when a patient's eyes met his with that same calm knowing, he wondered if they could see what he couldn't, if they already knew how their story would end. Dr. Bethany Kowalski had been awake for 19 hours straight when they brought in the John Doe from the pedestrian accident. It was 3:47 a.m. on a Tuesday, the kind of shift where coffee stopped working and muscle memory took over. The man was DOA, mid-50s, gray hair, wearing a wedding ring, but no ID. Blunt force trauma. died at the scene before the ambulance even arrived. Bethany's job now was paperwork. Document everything. Time of death, visible injuries, attempts at resuscitation. She sat at the nurse's station computer, fingers flying across the keyboard while her mind drifted to her bed at home. Patient presented unresponsive. No pulse, no respirations. Pupils fixed and dilated. Pronounced dead at scene 03:12 a.m. by paramedics. Body transferred to Mercy General Morgue pending identification and family notification. She saved the file and stood up, stretching her aching back. Down the hall, someone was coding. The overhead speaker crackled. "Trauma team to OR2. Trauma team to OR2. Bethany grabbed her coffee and ran. The surgery took 40 minutes. A motorcyclist with internal bleeding. They stabilized him, and Bethany finally returned to the nurse's station at 4:35 a.m. Her coffee was cold. Her back screamed. She just wanted to finish her shift notes and go home. She pulled up the John Doe's chart to add a final addendum about organ donation protocols. The screen loaded. Bethany froze. The note had been edited. New text at the bottom, same font, same formatting, same clinical tone she always used. "Please tell my wife I forgive her." Her heart hammered. She looked around the empty hallway. The night shift clerk, Trevor, was at the far end organizing files. No one else was near the computer. "Trevor," she called. "Did you touch this computer?" He looked up, confused. "What?" "No, I've been over here the whole time." Bethany scrolled to the document history. Last edited, 3:52 a.m., 5 minutes after she'd walked away. But she'd been in surgery. The station had been empty. "Did anyone else come by?" she pressed. Trevor shook his head. "Dr. Kowalski, it's been dead quiet. No one's been near that terminal." She read the sentence again. "Please tell my wife I forgive her." A chill crawled up her spine. The man had been wearing a wedding ring, but there was nothing about a wife in the chart. No emergency contact, no identification. They didn't even know his name yet. Bethany's hands trembled as she highlighted the sentence. Probably some kind of autofill glitch. Or maybe she'd typed it herself in her exhausted state and didn't remember. That had to be it. She deleted the line, saved the file, and closed it. But she couldn't shake the feeling of being watched. At 6:15 a.m., as the sun began to rise, a woman entered the ER. She was in her 50s, mascara smeared, eyes red from crying. She approached the front desk with shaking hands. "I'm looking for my husband," she whispered. "There was an accident last night on Riverside Drive. They said he didn't make it." Bethany was passing by when she heard. Something in the woman's voice made her stop. The clerk checked the system. "Name? Gerald Hutchins." The clerk typed, then nodded slowly. "Yes, ma'am. I'm very sorry. He was brought in early this morning. Let me get someone to—" "It's my fault," the woman suddenly sobbed, collapsing into a chair. "It's all my fault. I was driving, we were arguing, and I wasn't paying attention. I ran the red light and—" She buried her face in her hands, her whole body shaking. "He stepped out to help someone cross the street. It should have been me. He pushed me out of the way and—" Bethany's blood turned to ice. "Please tell my wife I forgive her." Mrs. Hutchins, Bethany said softly, kneeling beside her. I'm Dr. Kowalski. I was with your husband when he came in. The woman looked up, desperate for any connection to her husband's final moments. Did he suffer? No, Bethany lied. It was very quick. She paused, her throat tight. Mrs. Hutchins, did he know you blamed yourself? The woman's face crumpled. We were arguing in the car. I said terrible things. I was so angry about something stupid I can't even remember what, and then the light was red and I didn't stop and... She gasped for air. He died thinking I hated him. He died thinking I blamed him for the fight. Bethany's mind raced. No one had told this woman about the chart. No one on the team even knew Gerald Hutchins was married. There had been no wallet, no phone, nothing to indicate a spouse. Mrs. Hutchins, Bethany said carefully, I think your husband wants you to know something. The woman stared at her with hollow red-rimmed eyes. He forgives you. Mrs. Hutchins's face went pale. How could you possibly know that? Bethany couldn't explain it. Didn't want to. But she knew with absolute certainty that Gerald Hutchins had somehow reached across the divide between life and death to leave one final message. I just know, Bethany whispered. Later that morning, Bethany sat in the hospital administrator's office while the IT director, Kevin, pulled up the access logs for the nurse's station computer. You said the edit happened at 3:52 a.m.? Kevin asked, typing rapidly. Yes. He frowned at the screen. That's odd. What? There's no user activity logged at that time. The last login was yours at 3:44 a.m. when you created the file. The next one is yours again at 4:35 a.m. when you reopened it. Bethany leaned forward. That's impossible. Someone edited the file. I saw it. Kevin pulled up the document version history. 2 versions. Created 3:44 a.m., modified 3:52 a.m. But the modifier field was blank. This shouldn't be possible, Kevin muttered. Every action in our system requires user authentication. There's no way to edit a file without logging in. So what are you saying? Kevin removed his glasses and rubbed his eyes. I'm saying that according to our system, no one edited that file. It just changed on its own. Bethany felt her skin prickle. She pulled out her phone and showed Kevin a photo she'd taken of the screen. The sentence clear as day. Please tell my wife I forgive her. Run a diagnostic, she said. Check for malware, glitches, anything. Kevin did. For 3 hours, he combed through every line of code, every system log, every possible explanation. He found nothing. Bethany never told anyone else about what happened. Not fully. She filed an incident report that was promptly buried in bureaucracy, labeled as user error, despite Kevin's findings. But she started paying attention after that. To the small things. The impossible things. The patient in room 412 whose heart monitor displayed a message in Morse code. Dots and dashes that spelled out, "Thank you," just before he died peacefully with his children at his bedside. The elderly woman in the ICU who whispered the name of a nurse's stillborn daughter, a name the nurse had never spoken aloud at work. The X-ray that showed, just for a moment, the shadow of a hand reaching out, before disappearing when they looked again. Bethany didn't believe in ghosts. She was a scientist, a doctor. She dealt in facts, in biology, in things she could see and measure. But Gerald Hutchins had written a message that no living person could have typed. And sometimes, late at night when the hospital was quiet and the fluorescent lights hummed overhead, Bethany would sit at that same computer terminal and wonder, how many last words went unspoken? How many messages never delivered? And how many of the dead were still trying desperately to reach the living they'd left behind? She never got an answer, but she never stopped wondering. Dr. Isaac Brenner prided himself on precision. 15 years in trauma surgery had taught him that the difference between life and death was measured in millimeters, in seconds, in the steady hand that refused to shake even when exhaustion set in. So when they wheeled in the patient from the construction site accident, Isaac was ready. The man was in his 30s, unconscious, bleeding internally from a ruptured spleen and lacerated liver. His co-workers said a steel beam had fallen 3 stories, crushing him against scaffolding. By all accounts, he should have been dead before the ambulance arrived. But his heart was still beating. "Let's move," Isaac commanded, scrubbing in. His team assembled: nurse practitioner Jade Monroe, surgical assistant Reese Patterson, anesthesiologist Dr. Angela Torres. They'd worked together for years, a well-oiled machine. The surgery lasted 6 hours, textbook difficult. Isaac removed the spleen, repaired the liver, stopped the bleeding that seemed to come from everywhere at once. Twice the patient crashed. Twice they brought him back. At 4:47 a.m., Isaac sutured the final incision and stepped back, exhausted but satisfied. "He's stable," Dr. Torres announced, checking vitals. "Strong pulse, good oxygen saturation. This guy's got 9 lives." The patient, identified as Connor Malley, age 34, was moved to the ICU. Isaac went home, showered, slept for 3 hours, and returned to check on him. Connor was awake. "Mr. Malley," Isaac said, approaching the bed with a tired smile, "you gave us quite a scare. How are you feeling?" Connor's eyes were clear, focused. No confusion, no disorientation. Sore, but alive. He touched his bandaged abdomen carefully. "Thank you, doctor. You're very lucky. That beam should have killed you." Connor smiled, but it didn't reach his eyes. "Luck. Right." Something about his tone made Isaac pause, but before he could respond, Jade entered with medication. Isaac nodded and left to continue his rounds. The report started the next day. Jade found Isaac in the physician's lounge during lunch. "Dr. Brenner, can I talk to you about Mr. Malley? Is he deteriorating?" "No, that's not it. He's healing remarkably well, actually. It's just..." She hesitated, looking embarrassed. "This is going to sound crazy." Isaac set down his coffee. "Try me." When he walks to the bathroom, past the window in his room, you know, the one that reflects like a mirror at night, his reflection delays. Isaac blinked. Delays. Like a half-second behind his movements. I've seen it 3 times now. At first I thought it was the glass. But I checked my own reflection, and it was fine. It's only him. Isaac studied her face. Jade was rational, experienced, not prone to flights of fancy. Lack of sleep can cause visual distortions. When did you last have a day off? I know what I saw, Doctor. Before Isaac could respond, Reese appeared in the doorway. Dr. Brenner, have you checked on Mally lately? Not since this morning. Why? Come see for yourself. Connor was standing by his window, looking out at the parking lot. The afternoon sun streamed through the glass, casting his shadow on the floor. Except the shadow wasn't quite right. Isaac watched as Connor raised his hand. The shadow on the floor moved a fraction of a second later. When Connor turned his head, the shadow followed, but not quite in sync. Mr. Mally, Isaac said, keeping his voice calm. How are you feeling? Any dizziness? Disorientation? Connor turned. His reflection in the window turned too, but it kept moving after Connor had stopped. For just a heartbeat, maybe less. But Isaac saw it. The reflection's head continued its rotation, then snapped back to match Connor's position. Isaac's mouth went dry. I'm going to run some additional tests. Make sure everything's healing properly. It won't show anything, Connor said quietly. Excuse me? The tests. They won't show anything wrong, because nothing is wrong. Connor sat on the edge of his bed, wincing slightly. Not medically anyway. Isaac pulled up a chair, his clinical instincts warring with something deeper, more primal. Mr. Mally, what do you mean? Connor was silent for a long moment. Then, do you believe in second chances, Doctor? That night, Isaac stayed late, catching up on paperwork. The ICU was quiet, most patients sedated or sleeping. Around 11:30 p.m., he decided to check on Connor one more time before heading home. He was walking down the corridor when Connor's room alarm began shrieking. Isaac ran. He burst through the door to find the bed empty, sheets thrown back, IV line torn free, and dripping saline onto the floor. Code yellow, ICU, he shouted into the hallway. Patient missing from room 304. Jade rushed in. How long has he been gone? I don't know. Call security, check the cameras. While Jade made the call, Isaac searched the room, the bathroom, under the bed. Nothing. No sign of Connor. Security arrived within minutes. The guard, Officer Damian Cruz, pulled up the live feed on his tablet. Room 304, right? Let me rewind. He stopped. Isaac looked at the screen. Connor Mally was lying in his bed, motionless, eyes closed. The timestamp showed 11:28 p.m., 2 minutes before the alarm. That's impossible, Isaac whispered. The bed is empty. Officer Cruz rewound the footage. There. 11:15 p.m., Connor got up, walked toward the door. The camera should have shown him leaving. But instead, at 11:16 p.m., Connor was back in bed, as if he'd never moved. Glitch in the system? Jade suggested, her voice shaking. Officer Cruz fast-forwarded. The footage showed Connor lying peacefully in bed until 11:38 p.m., the current time. This doesn't make sense. According to this, he's still there. Isaac stared at the empty bed, then at the screen showing a sleeping patient. Search the floor, he ordered. Every room, every closet, now. They found Connor in the east stairwell. His body was cold. Rigor mortis had already begun. According to the medical examiner who arrived later, he'd been dead for at least 40 minutes. since approximately 11 o'clock p.m., but the security footage showed him alive in bed until 11:38 p.m., 10 full minutes after he was already dead. Isaac stood in the stairwell staring at Connor's body. The man's eyes were open, glassy, staring at nothing. His surgical wounds had reopened, blood soaking through his hospital gown. "Dr. Brenner?" Officer Cruz approached, tablet in hand. His face was ashen. "I pulled all the footage from every camera on this floor. You need to see this." Isaac looked at the screen. The footage showed Connor walking down the hallway at 10:58 p.m. Past the nurse's station where Jade sat typing, oblivious. Past the supply closet, toward the stairwell. But his reflection in the window beside him didn't move. It stayed in his room, lying in bed. "That's not possible," Isaac breathed. "There's more." Cruz rewound to earlier that evening. 7 o'clock p.m., Connor eating dinner. His reflection in the window ate nothing. 8:30 p.m., Connor reading a book. His reflection lay motionless. 9:45, 5 p.m., Connor watching television. His reflection stared at the ceiling. "It's like..." Cruz struggled for words. Like his reflection wasn't his anymore. Isaac felt ice in his veins. He thought about what Connor had said. "Do you believe in second chances?" The IT department spent 2 days analyzing the security system. They found no glitches, no corrupted data, no technical explanation for the footage. The medical examiner's report showed Connor died of complications from his original injuries. Massive internal hemorrhaging that shouldn't have been possible given Isaac's successful surgery. It was as if his body had simply decided to die, regardless of medical intervention. Isaac tried to move on, but he couldn't stop thinking about Connor's words. "It won't show anything wrong." Because nothing is wrong. 3 weeks later, Isaac was reviewing old hospital records, looking for anything, any pattern, when he found it. Connor Malley had been admitted to the same hospital 6 years earlier. Different injury, same outcome. Should have died, but survived. The attending surgeon had noted in the chart, patient exhibited remarkable recovery, almost supernatural. Isaac's hands trembled as he dug deeper. 9 years before that, another admission. Connor Malley, age 19, motorcycle accident, fatal injuries, survived. 12 years before that, car crash, age 13, declared dead at the scene, revived en route to hospital. Each time, Connor Malley had died. Each time, he'd come back. Isaac sat in his dark office, the only light coming from his computer screen. He thought about reflections that lagged. Shadows that didn't quite match. Security footage that showed a man in 2 places at once. He thought about Connor's final words. "Do you believe in second chances?" And he wondered, how many times can someone cheat death before death stops letting them borrow their own reflection? Connor Malley had died in that stairwell. But which version of him had died? The body in the bed? Or the one walking down the hall? Isaac never found the answer. But sometimes, late at night when he walked past reflective surfaces, he made sure his reflection matched his movements exactly, just to be sure it was still his own. Dr. Naomi Fletcher had performed hundreds of splenectomies in her 12-year career. The procedure was routine. Complicated, yes, but routine. Remove the ruptured spleen, control the bleeding, close. She could do it in her sleep. Tonight's patient was a motorcycle accident victim. Male, 28 years old, named Tyler Moss. Blunt force trauma to the abdomen. Ruptured spleen with active hemorrhaging. He'd been stable when they intubated him, joking nervously with the nurses about his ruined bike. Now he lay unconscious on the operating table, prepped and draped. "Anesthesia ready?" Naomi asked, adjusting the overhead light. Dr. Elliot Graves, the anesthesiologist, checked his monitors. All set. He's under deep sedation. Muscle relaxant administered. He won't feel a thing. Beside Naomi stood her surgical resident, Dr. Quinn Albright, and scrub nurse Pamela Reed. They'd worked together on countless surgeries. Tonight should be no different. Naomi made the first incision. 20 minutes into the surgery, everything was going smoothly. Naomi had isolated the spleen, clamped the vessels, and was preparing for removal. The bleeding was controlled. Tyler's vitals were rock solid. Then Pamela gasped. "Dr. Fletcher?" Naomi looked up from the surgical field. Pamela was staring at Tyler's face. Tears were streaming from his closed eyes, running down his temples into his hair. "What the hell?" Quinn whispered. Naomi's heart skipped. "Elliot, is he awake?" Dr. Graves checked his monitors, his anesthesia machine, the IV lines. "No, impossible. Look at these readings. He's completely under. Brain activity shows deep sedation. The paralytic is working. He physically cannot be conscious." But the tears kept coming, silent, steady, like someone crying without making a sound. "Maybe it's just reflex tearing," Pamela suggested, her voice uncertain. The eyes can produce tears even under anesthesia. Naomi had seen reflex tearing before. This wasn't it. This was too much, too continuous. But the monitors showed no signs of awareness. No elevated heart rate, no blood pressure spike, nothing. "Keep going," Dr. Graves said. "I'm monitoring him closely. If anything changes, I'll let you know immediately." Naomi returned to the surgery, but her hands felt unsteady. She tried to focus, but the image of those silent tears wouldn't leave her mind. She reached for a Kelly clamp. It slipped from her gloved fingers, clattering onto the instrument tray. "Sorry," she muttered, retrieving it. "Quinn, suction here." The surgery continued. Naomi removed the spleen, checked for additional bleeding, began the closure. Sweat beaded on her forehead despite the cool OR temperature. She reached up with the back of her wrist and wiped it away. The tears on Tyler's face had finally stopped. "Vitals still stable," Dr. Graves reported. "Heart rate 68, BP 118/76. He's fine." Naomi exhaled slowly. "Let's close him up." 2 hours later, Tyler Moss began to wake in the recovery room. Naomi was completing her post-op notes when the recovery nurse, Jordan Webb, paged her. "Dr. Fletcher, you need to come down here. Mr. Moss is agitated." When Naomi entered the recovery bay, Tyler was sitting upright in bed, eyes wide, breathing rapidly. Jordan stood beside him, one hand on his shoulder. "Mr. Moss, your surgery went perfectly," Naomi said calmly, approaching the bed. "You're going to be—" "I saw you drop the clamp," Tyler interrupted, his voice shaking. Naomi stopped. "What?" The clamp, you dropped it. It fell on the tray and made a loud noise. His eyes locked onto hers, filled with terror. I saw you wipe your forehead with the back of your hand because your gloves were bloody. The room felt suddenly cold. Mr. Moss, you were under general anesthesia. You couldn't have. You kept saying everything was fine, Tyler continued, his voice rising. You said it to the other doctor, the young one. You told him the bleeding was controlled. You sounded confident, but I could tell you were worried. Quinn. He was describing Quinn. There was a woman in blue, Tyler said, pointing at Pamela, who had just entered the recovery area. She handed you instruments. She was the one who first saw me crying. Pamela's face went pale. Naomi's medical training kicked in. Mr. Moss, sometimes patients can hear things during surgery, even under anesthesia. It's rare, but I wasn't hearing, Tyler said, his voice dropping to a whisper. I was watching. That's not possible. You were unconscious, paralyzed. Your eyes were taped shut. I know. Tyler's hands were shaking. I know they were. But I could see everything. Mr. Moss, I wasn't in my body. He looked down at his hands as if they belonged to someone else. I was standing behind you, to your left. I watched you operate on me. I watched you cut me open. I tried to scream, but nothing came out. I tried to move, but I couldn't. I was just there, watching. Naomi felt her stomach drop. Mr. Moss, you're confused. The anesthesia can cause... The light above the table flickered twice, Tyler said, around 20 minutes in. The big doctor, the one at my head, he adjusted something on the machine. It beeped and he turned it off. Naomi looked at Jordan, who looked at Pamela, who stared at Tyler in disbelief. Everything he described had happened. The flickering light. Dr. Graves adjusting the IV pump. The alarm he'd silenced. Things Tyler couldn't possibly know. Things that happened while he was intubated, paralyzed, unconscious, with his eyes taped shut. You said there was a lot of blood at first, Tyler continued, his voice mechanical now, as if reciting from memory. More than you expected. You asked for more suction. You said... He closed his eyes. You said, come on, Tyler, hang in there. Like you were talking to me. But I was right there. Behind you. And you didn't know. Naomi's mouth was dry. She had said that. Exactly that. Mr. Moss, I need you to try to stay calm. What you're describing sounds like anesthesia awareness, which is extremely rare. I wasn't aware, Tyler said flatly. I was dead. Silence. What? Naomi whispered. That's what it felt like I'd died. Like my soul, or whatever you want to call it, got pulled out of my body. I could see myself on the table. I could see the monitor with my heartbeat. I could see everything. He looked up at her, eyes hollow. And I couldn't get back in. Naomi ordered a full psychiatric evaluation. Dr. Helena Rourke, the hospital psychiatrist, spent an hour with Tyler. Her report was inconclusive. Tyler showed no signs of psychosis, no history of mental illness, no drug use. He was coherent, rational, and utterly convinced of what he'd experienced. He's describing a classic out-of-body experience, Dr. Rourke told Naomi later. Similar to near-death experiences. Some patients report watching their own resuscitation from above. The literature on this is complicated. He wasn't dying, Naomi said. His vitals were stable the entire time. I know. That's what makes this unusual. Dr. Rourke paused. Dr. Fletcher, he described things he couldn't possibly have known. Specific details about the OR, about your actions. How do you explain that? Naomi didn't have an answer. Tyler refused to sleep. For 3 days, he stayed awake. Nurses found him pacing his room, staring out the window, jumping at shadows. When they tried to give him sedatives, he became hysterical. I'm not going under again, he told Naomi on the second day. I can't. What if I can't get back this time? What if I get stuck wherever I was? Mr. Moss, that won't happen. You're healing well. You'll go home soon. I don't think I ever came all the way back, he whispered. I think part of me is still standing in that room, watching. On the third night, Tyler finally collapsed from exhaustion. He slept for 16 hours. When he woke, he seemed calmer, more present. But there was something different in his eyes, something distant. He was discharged 2 days later. Naomi tried to forget about Tyler Moss. She threw herself into work, performed surgeries with her usual precision. But sometimes, in the middle of a procedure, she would feel it. The sensation of being watched. She would look up from the operating table, expecting to see someone standing in the corner of the OR. But there was never anyone there. Just her team. Just the patient under anesthesia. Just the patient. One night, 6 weeks after Tyler's surgery, Naomi was operating on a woman with internal bleeding. The patient had been under for 40 minutes when Naomi noticed it. Tears, streaming silently down the woman's face. Elliot, Naomi said, her voice tight. Check the anesthesia. Dr. Graves checked. Everything was perfect. Deep sedation, complete paralysis. But the tears kept flowing, and Naomi felt it again, that presence, standing just behind her, watching. She spun around. The OR was empty except for her team. But in the reflective surface of the surgical light, she saw something. A shadow, translucent, barely there, standing exactly where Tyler said he'd been standing. Naomi's hands began to shake. Dr. Fletcher? Quinn's voice sounded far away. Are you okay? She looked back at her patient, at the tears, at the steady, vital signs that said everything was fine. And she wondered how many of her patients had stood behind her, watching. How many had been pulled from their bodies, trapped between life and death, unable to scream. How many were still there, standing in the OR, watching surgeries they would never remember when they woke. If they woke. Naomi finished the surgery. The patient recovered without incident. No memory of tears, no memory of watching, but Naomi remembered. And now, every time she operates, she feels them. The watchers, the ones caught between, the ones standing just outside their own bodies, silent and terrified. She never looks behind her anymore. She's afraid of what she might see.